My name is Chris Andrew. I'm a nurse practitioner, board certified in emergency and family medicine. Patient care has been a part of my life for over a decade. I'm also certified as a functional medicine hyperbaric clinician, where I've been privileged to help people optimize their mitochondrial function. Today, I want you to understand what mitochondria are and their role in your vitality. Know how dysfunctional mitochondria impact your health. Recognize common signs that indicate mitochondrial dysfunction. Learn which everyday foods, habits, toxins can affect your mitochondrial health. Discover natural ways to support mitochondrial health. And finally, we're going to touch on hyperbaric oxygen therapy, or HBOT, and how it can help restore mitochondrial function and promote healing from within. First, a quick note, this presentation is for educational purposes only and is not meant as personal medical advice. Please consult your provider for individualized care. I know what you guys are thinking. I didn't sign up today for a biology class. This is a mitochondrion. Who here graduated middle school? Then you know that mitochondria are the... That works every time. I gotta be honest with you. I didn't graduate middle school. I was homeschooled. I had to learn about mitochondria in the second grade. You guys are thinking, that explains a lot about this guy. The majority of your cells are in a continuous process called aerobic respiration. This occurs when mitochondria take glucose and oxygen to produce adenosine triphosphate, or ATP. ATP equals cellular energy. This powers nearly every function that keeps you alive. Wow. Doesn't this look like galaxies in the Milky Way? This is actually a microscopic photo of mammal tissue. The gray structures are cells. The blue structures are the nuclei of the cells. That's what contains DNA. And the mitochondria have been stained bright yellow. Some cells, like red blood cells, don't have or need mitochondria. The job of red blood cells are to carry oxygen to the rest of the body. And they're designed so that they don't use the oxygen that they're carrying. Other cells, like muscle or heart cells, contain thousands of mitochondria. The brain is also highly metabolically active. It's only 2% of body weight, but it uses about 20% of the body's oxygen. Your body makes its own energy every second, enough to power a 100-watt light bulb. So what does your body do with this energy it produces? Every heartbeat, breath, and movement is powered by ATP. It fuels the electrical impulses that carry thoughts and reactions. It helps build proteins, DNA, and cell membranes. ATP moves nutrients and ions in and out of cells. And it drives enzyme activity for recycling and repair. As you can see, ATP function is essentially not only to sustain life every second you breathe, but it's an integral part of your vitality. Mitochondria sit at the center of metabolism. Nutrients, including fats, proteins, and sugars, are broken down and combined with oxygen to produce energy in the mitochondria. Your cells then use that energy to build complex molecules for tissue growth, hormones, and cell repair. So when mitochondria become dysfunctional, metabolism falters. This can lead to many disorders and diseases. Now, mitochondrial dysfunction is likely a key player in just about every disease process. Of course, there's other factors like genetics, epigenetics, inflammation, and so on, but we're here to talk about mitochondria. Some of the most common disease processes that have the highest direct association with mitochondrial dysfunction include Alzheimer's disease, Parkinson's disease, type 2 diabetes, atherosclerosis. This is the hardening of artery walls and the accumulation of plaque deposits. Mitochondria and blood vessels release free radicals, causing inflammation and leading to cardiovascular disease. Chronic fatigue syndrome, abnormal recovery of mitochondrial membrane potential after exertion leads to reduced energy production. Cancer, this is called the Warburg effect. Normal cells, as we discussed, combine glucose with oxygen to produce energy. In the 1920s, Dr. Otto Warburg discovered that tumor cells actually ferment glucose without the use of oxygen. This reprograms mitochondrial metabolism and signaling. And finally, autoimmune diseases stimulate high levels of reactive oxygen species, which signal an inflammatory cytokine response and damages tissues. Some examples include rheumatoid arthritis, lupus, ulcerative colitis, and Crohn's. As we age, mitochondrial function tends to decline. This decline is associated with decreased energy production. As mitochondria become less efficient, cells have less ATP available. This leads to fatigue, slower repair processes, and diminished overall vitality. Increased oxidative stress. Dysfunctional mitochondria produce more reactive oxygen species, or ROS, damaging DNA, proteins, and lipids. This is a key driver of aging at the cellular level. Reduced mitochondrial biogenesis. Mitochondria replicate less effectively with age, leading to fewer mitochondria per cell, further exacerbating energy shortages and damage. And finally, mitochondrial DNA mutations. Do you know that your mitochondria have their own DNA? Over time, mutations in mitochondrial DNA accumulate, impairing the ability of mitochondria to produce energy, which accelerates the aging process and contributes to age-related diseases. So how do you know if your mitochondria are dysfunctional? There is no lab test that you can take to tell you. Instead, we piece together patterns that give us clinical clues. Common symptoms include fatigue not relieved by rest, energy crashes, exercise intolerance, brain fog, migraines, blood sugar swings, insulin resistance, cold intolerance. Who here moved to St. George from northern Utah or Idaho? Yeah, I can't stand the cold either. Good news is, down here you don't have to shovel the sunshine. Muscle weakness, soreness, slow recovery, and poor stress tolerance. If any of these symptoms resonate with you, you may have some element of mitochondrial dysfunction. Babies aren't stressful, are they? Just kidding. I was searching Google for an image to put on this slide, and I used the keywords energy sucker, and this popped up. I get it. I've got 2 kids, 4-year-old and a 1-year-old. I couldn't resist. Now let's get back to mitochondria. Just about everything we put into our mouths ultimately converges on our mitochondria. When we overload the system with refined sugar, ultra-processed foods, and constant eating, our mitochondria drown in excess fuel. Too much glucose and insulin lead to oxidative stress and eventually insulin resistance, making our cells less able to use energy efficiently. Add that to the hidden load of pesticides, plastics, and environmental toxins. Many of these compounds directly damage mitochondrial membranes or block the enzymes inside the electron transport chain. This chokes off energy at the cellular level. Chronic psychological stress adds another layer. Elevated cortisol and adrenaline increase free radical production, drain antioxidants, and signal the body to stay in survival mode, diverting resources away from repair and regeneration. And then there's sleep, or lack of it. All the parents of young children in the room know what I'm talking about. Deep sleep is when mitochondria perform their maintenance cycle, clearing out damaged components through mitophagy and producing new ones through biogenesis, Without adequate sleep, that cleanup doesn't happen. The result, fatigue, inflammation, and accelerated aging. I love this pharmacist holding up a massive pill. Each capsule contains your medication plus a treatment for each of its side effects. Have any of you ever been prescribed a drug to treat the side effects of another drug you're on? Some prescription medications also disable mitochondria. Cholesterol-lowering drugs, such as atorvastatin, simvastatin, rosuvastatin, and others, interfere with mitochondrial pathways. These effects are commonly noticed as muscle fatigue and weakness. Statin use has been associated with the development of diabetes and dementia. It depletes the body's supply of ubiquinone, an essential part of energy production and antioxidant. All my clinic patients who come to me on statins, I recommend supplementation with CoQ10, a form of ubiquinone. Certain chemo medications increase reactive oxygen species while also disabling antioxidant defenses. It's impossible to only target cancer cells, and healthy cells are harmed in the process. Interestingly, the DNA in human mitochondria share very similar traits with DNA in bacteria. Some antibiotics, including gentamicin, ciprofloxacin, levofloxacin, and doxycycline, block mitochondrial synthesis. Propranolol is a common beta blocker used for high blood pressure, abnormal heart rhythms, tremors, and even anxiety. At higher doses, propranolol decreases mitochondrial oxygen consumption and reduces ATP production. Tylenol has been a controversial subject lately. Even at therapeutic doses, its mechanism is to bind to mitochondria, impairing electron flow. These effects are most pronounced in the liver, where Tylenol is metabolized. It consumes glutathione stores, an important antioxidant. The two biggest factors in building mitochondrial health I call fuel and flow. Just as essential as oxygen, fuel powers the production of ATP. Everyone's dietary needs are different, so I'm speaking in generalities here. What the data shows is that a Mediterranean diet is the best way to support mitochondrial function. A Mediterranean diet is rich in whole foods with lots of plants, lean proteins, and healthy fats. A Mediterranean diet is also high in polyphenols, which convert to antioxidants to scavenge free radicals. This protects DNA and mitochondrial proteins. Intermittent fasting also has a wealth of science backing its benefits for mitochondrial health. Intermittent fasting is also termed time-restricted eating. You're fueling within an 8-hour window each day. The other 16 hours, your mitochondria undergo a metabolic reset. This reset activates mitophagy, the cell's way of removing damaged mitochondria and recycling their components. Biogenesis is the formation of new mitochondria. During fasting, our metabolism shifts from burning glucose to burning fat, aka ketosis, and this reduces oxidative stress. And finally, fasting stimulates enzymes that slow aging and support metabolic resilience. We talked about fuel, now let's discuss flow. Let me introduce a concept called hormesis. Hormesis is a biologic principle where low or moderate stressors trigger an adaptive beneficial response in cells. In other words, a little stress makes your cells more strong, more efficient, and more resilient. Physical exercise is a form of hormetic stress that make your mitochondria stronger. Your mitochondria respond differently to different types of exercise. This is a photo of my office manager, Talon. In another life, he was a personal trainer. You'll have to ask him more about fitness and mitochondrial health. Endurance, or cardio, stimulates mitochondrial biogenesis. It also increases mitochondrial density. More mitochondria per muscle fiber means higher oxidative capacity. It trains mitochondria to burn fat as fuel. High-intensity interval training stimulates biogenesis even faster than endurance training does. HIIT also improves mitochondrial quality, making them more efficient. Thirdly, HIIT increases electron transport improving ATP production. HIIT also ramps up VO2 max. The key mechanism behind resistance or strength training is this ability to improve aerobic respiration. This heightened function enhances ATP production per mitochondrion. Evidence tells us that if you had to choose just one, high-intensity interval training boosts mitochondrial function faster. Let me circle back to VO2 max. This is the maximum volume of oxygen that your body can use during intense exercise. Higher VO2 max indicates greater endurance, as your heart and lungs can supply more oxygenated blood to muscles, which improves performance and recovery. Higher VO2 max also means you're more metabolically active, so you're burning more calories even at rest. We were talking about resistance training. Randy Glassbergen hits the nail on the head with this one. Resistance training is just as important as cardio. Train yourself to resist chocolate, pastries, fried foods, beer, pizza. I love this slide. First of all, that's my hot wife, who also happens to teach these power habits as a yoga instructor. Secondly, these power habits just make you feel good. 10 to 20 minutes of sunlight exposure within an hour of waking supports mitochondrial regulation. Avoid blue light within an hour of going to sleep to reduce oxidative stress. To truly reap these benefits, you should maintain consistent wake and sleep times. Cold exposure also stimulates mitochondria. Taking a cold shower or hopping in an ice bath activates brown adipose tissue. Burning fat for heat. This process triggers biogenesis. Start small, 30 to 60 seconds, and increase to 2 to 5 minutes, 3 to 5 times per week. Manage stress. Stress increases cortisol, and this leads to mitochondrial dysfunction. Even 10 to 20 minutes a day of yoga, meditation, or breath work can reduce oxidative stress markers. Proper hydration is essential for mitochondrial function. If your cells are dehydrated, ATP production falters. Adult men require 2 to 2.6 liters of water per day, and adult women require about 1.6 to 1.8 liters. An assessment of urine color gives you a good idea of your hydration status. It should look more like lemonade than apple juice. Let's touch on a few helpful supplements. There are individual considerations for each that are outside the scope of this presentation, so do your own research and consult your provider. I mentioned CoQ10 earlier. This is a direct cofactor in the electron transport chain, essential for energy production. It also protects mitochondrial membranes from oxidative stress. A typical dose is around 200 milligrams per day of ubiquinol. Alpha-lipoic acid is another cofactor, and it helps to regenerate antioxidants such as glutathione, vitamin C, and vitamin E. 300 to 600 milligrams is usually recommended. Creatine is another high-yield supplement for mitochondrial health. It acts like a cellular battery backup by stabilizing ATP output in energy-hungry tissue. This ensures ATP is immediately available when and where it's needed. People on creatine tend to notice improved cognitive performance, faster muscle recovery, and lower fatigue. 3 to 5 grams per day is generally recommended. Methylene blue is a prescription medication. It was actually the first fully synthetic drug used in medicine in the 1890s. In contrast to the other supplements, methylene blue is not a naturally occurring substance within the body. You can't have a methylene blue deficiency. However, it is a universal donor in the electron transport chain, so it can be helpful to bypass dysfunctional links. 0.5 to 1 milligram per kilogram per day is generally sufficient for a short duration. I mentioned urine color on the last slide. Interestingly, methylene blue is not metabolized by the body, so your pee turns bluish green. You guys probably think I'm weird. Why does he keep talking about pee? Ultimately, oxygen is the final electron acceptor in the electron transport chain. Oxygen is classified by the FDA as a drug, so it requires a prescription. However, our body uses it more as a nutrient. This is where hyperbaric oxygen therapy, or HBOT, comes in. I'll take questions in a moment. Simply stated, HBOT is the powerful combination of oxygen, increased atmospheric pressure, and time. The key component here is pressure. In my clinic, we use Henry's gas law to our advantage. The more pressure you exert on a gas, the more of it is dissolved into nearby liquid. I like to compare this to a soda can. Inside the can, the gas carbon dioxide is dissolved in the liquid soda. When the pressure is released, the gas reaccumulates outside of the soda. In a hyperbaric chamber, we're doing the reverse. We're actually forcing oxygen into the liquid portion of your blood, plasma, completely bypassing the oxygen-carrying red blood cell. At sea level, we're at 1 atmosphere, which is enough pressure to allow normal gas exchange. In a hyperbaric chamber at 2 atmospheres, we're increasing the oxygen within the plasma by over 1,200%. This temporary megadose of oxygen is utilized by mitochondria to create a foundation of self-healing. A typical HBOT session involves a 60 to 90 minute treatment inside a steel-walled chamber. It's a very relaxing experience, and patients will often read, nap, or meditate during their treatment. Unapproved electronic devices such as cell phones are not allowed inside for safety reasons. This also creates an escape from the world, allowing the mind and body to focus on healing. Depending on what condition the patient is treating for and their health goals, an average protocol could range from 10 to 40 back-to-back sessions. Timing is key here, and daily treatments create lasting changes within the body. During this session, prescription quality oxygen is delivered directly to the airway through a mask or a cannula. Of course, safety should be at the forefront of every clinic providing hyperbaric oxygen therapy. It's paramount that each facility operate FDA-cleared chambers, adhere to the established safety standards, and the providers be certified. HBOT is exceedingly safe when performed correctly. With the right amount of oxygen, the body's natural functions flourish. HBOT stimulates multiple healing pathways simultaneously. These include optimization of mitochondrial function, stem cell mobilization, new blood vessel growth, increased antioxidant proliferation. It stimulates neuroplasticity, in other words, how the brain adapts and rewires itself. This is especially beneficial for patients who have had a stroke or traumatic brain injury. It decreases senescence, aka cellular aging. It modulates the immune system, helping to combat infections. And finally, it alleviates inflammation. These effects certainly benefit our ill and injured patients. But one of the things I love about functional medicine is that the therapies and principles that we use also benefit healthy people. HBOT is used as a recovery tool for Olympic athletes, by biohackers to enhance longevity, and folks who simply desire to improve the effects of aging. Let's take a look at what the data shows us. 2 years ago, scientists in South Korea studied heart muscle cells when they were exposed to HBOT. Exposure to oxygen puts a little bit of stress on our cells. This produces reactive oxygen species. This hormetic stress stimulates positive outcomes. In this case, ROS from HBOT exposure increased antioxidant production and increased mitochondrial biogenesis. In other words, HBOT stimulates mitochondria to increase in size, number, and density. This in turn improves energy production. Here's another interesting one. Mice with Parkinson's disease underwent 7 days of HBOT. This decreased loss of neurons and improved tremors through mitochondrial biogenesis. Ischemia reperfusion injury. Let me explain this one. When tissue is deprived of blood, we call this ischemia. It doesn't get enough oxygen to produce energy efficiently, We see this in strokes, heart attacks, surgery, and trauma. When blood flow is restored, this is called reperfusion. This sudden rush of oxygen actually causes more damage before the healing begins. When mitochondria become overwhelmed, they start leaking electrons. This causes inflammation and damages membranes, proteins, and DNA. One of the ways HBOT helps is by priming your cells to survive trauma of surgery. In this study, 14 HBOT sessions were performed before cutting off blood supply to heart cells. When circulation was restored, cellular damage was inhibited and mitochondrial function was preserved. Imagine a neighborhood that lost power, ischemia. When the power company suddenly restores electricity, reperfusion, the surge can blow fuses and damage electronics, unless there's a surge protector in place. HBOT acts like that surge protector, helping the cells handle the return of oxygen safely. If you have a surgery coming up, do hyperbarics for a week or two before. It's game-changing. Not only do you get this reduction in reperfusion injury, but stem cells are mobilized, inflammation is reduced, collagen synthesis is ramped up, and new blood vessels grow. In my experience, patients recover about 50% faster, are less reliant on opioids, and have improved scarring. Throughout the years, there have been a good deal of focus on using HBOT for recovery. Professional athletes use HBOT as part of their recovery regimen, including LeBron James, Cristiano Ronaldo, Michael Phelps, and Joe Namath, who, by the way, use HBOT as a tool to help him heal from repeated concussions as an NFL quarterback. However, this human randomized control trial demonstrated that HBOT holds benefit for sports performance. Middle-aged athletes did 40 HBOT sessions, and the HBOT group had significant increases in VO2 max, anaerobic threshold, and mitochondrial capacity. This is direct evidence that HBOT enhances mitochondrial function and mass, translating into performance improvements. Dr. Shai Efrati, researcher at Tel Aviv University and author of the book Beyond Normal, describes the regenerative field of hyperbaric medicine. We're unlocking the body's potential to heal itself. It's about using the environment to achieve what surgery and chemicals cannot. The greatest satisfaction I get in the clinic is helping patients change their lives. Hyperbarics is a simple yet profound metabolically healing therapy. By addressing the root cause of mitochondrial dysfunction, we allow the body to naturally heal itself. Contact info. I've got a booth on the entrance, the second booth down. I'd love to open up for a few minutes of questions here. Yeah.
Stay back to back, like how close are you talking?
So the question was, as far as back-to-back, what's the frequency of treatment? So typically, and it depends on what the patient's treating for, but typically sessions are about 4 to 5 sessions per week. So almost every day.
They're usually like an hour long?
Yep, 60 to 90 minutes generally.
Do you have any shorter versions here today?
Yeah, today we're actually doing free 15-minute sessions, so you can try it out. We're not doing the oxygen, but you can try the pressure and see how it feels. Yes?
What about reimbursement or insurance?
So insurance covers 14 or 15 what's considered on-label indications. So these are things like diabetic foot ulcers, carbon monoxide poisoning, etc. What we're doing in the clinic is using hyperbarics off-label. So things like semaglutide is used off-label for weight loss. It's a diabetes drug. And so because of that, we can't charge insurance, and we don't charge insurance, so it's just cash pay. But you can use HSA or FSA.
When you were talking about methylene blue, you said that it's on a prescription. So, a little while ago, I bought some off of Amazon. So in the liquid drops, you're saying that's none. What is that?
The supplements of methylene blue, so it's also used as a tank cleaner for like fish tanks. And so as a supplement version, you just don't know what exactly you're getting. I'm sure it's probably some methylene blue, but it could be mixed with other things. It's best to get it from a compounded pharmacy. So Fusion Specialty Pharmacy in town does it. There's a few others. So that way you know exactly what you're getting, the exact dose. And
Plus it may interact with some antidepressants.
correct. Yeah, there's certainly individual considerations. So yeah, definitely it's best to get it as a prescription.
What's your gate number?
We're 502, so it's this first entrance, second one on the left. Yeah, you can't miss us. We have a big, huge tank. Any other questions? Thanks for coming, guys. Appreciate it.